Hey guys, it's Dave. Today we're going to talk about endometriosis. We've had several questions come up on our TikTok lives about that, so we'll go over it. It's a painful condition that occurs when tissue that is normally in the endometrium actually grows outside of the uterus. It can grow on the outside of the lining of the uterus. It can grow along the fallopian tubes. It can grow in the lining of the pelvis. And it also can involve the ovaries as well. Rarely it can show up in other areas of the body, such as the vagina, the rectum, the abdomen, or even higher up along the bladder. But that rarely occurs. What happens is it still behaves as though it was in the uterus. So every month in the monthly cycle, it will become inflamed, swollen, then shed and bleed. So normally in the uterus it has an escape route, but with endometriosis there's no escape route. So that all occurs and stays within the area where it is located. It also will build up over time, causing scarring and pressure, and that can lead to some problems with things such as infertility and more increased pain as well. When it involves the ovaries, cysts can develop, and that can become a painful situation for women, and along with causing problems with infertility. You'll have to go in, get those checked out, and those cysts can be removed. The scar tissues and adhesions that can form over time from the tissue continuing to build up is where fertility issues can occur, and down the line you can have an increased risk of cancer with that. As far as symptoms, you'll get painful periods, painful cramping, and I know that for most women all periods are painful, but this is like pain and cramping on steroids, very severe. You'll get pain on urination or when you have a bowel movement. You can have pain with intercourse, and you can have extended unnormal bleeding times with your period where it will be very heavy. And then throughout the month, you can even have spotting that occurs. If this happens, you want to make sure you get a hold of your provider, let them know, because you want to get on top of it early before the buildup starts to occur that I mentioned, which would make you more prone to having issues with fertility and long-term with cancer as you go. The exact cause is really unknown. However, there is a genetic component to it. If you have a sister, if you have an aunt, a grandma, or a mom that has it, you're going to be more likely to have it. They've linked maybe a possibility of having an immune problem with an immune system disorder going against your own body on that. Also a retrograde menstruation where instead of flowing out, it actually flows back up. So some of that tissue can be put in the fallopian tubes where it then grows and develops, and that can cause a problem. If you've had scarring from either having a C-section or a hysterectomy, that scarring can cause problems which may lead to endometriosis, as well as a couple of other ideas where they think that there could be some cell transformation occurring where normal cells are turning into endometrial cells, and that is locating them outside of the uterus where they're normally found. So all of those, they really don't know. It's speculation, but the genetic component there definitely is there, because if you have relatives, like I said, you're going to be at a higher risk of having endometriosis. Some other risk factors that are there are a low BMI. This is unusual. Generally, people with high BMIs are at risk for disease. In this case, females with low BMI are at a higher risk of endometriosis. If you've never given birth, that's another risk factor. If you started your periods at a very young age, that's another one, as well as if you're continuing to have your periods past where you think you should be in menopause, or your family members were in menopause, you're at a higher risk. If you have short menstrual cycles, so they're not the normal, they're shorter, that's another risk factor, as well as having heavy periods for greater than 7 days. If you've had surgery, like I said, with a hysterectomy or C-sections or multiple C-sections, you're at a greater risk, as well as you have higher estrogen levels in most females. If you've had to be put on anti-estrogen medications because of that, that's going to increase your risk, as well as if you have any physical malformities, like a uterus that may be shorter than normal or any blockage that may occur there, that's going to put you at greater risk. If you're pregnant, the symptoms can actually go away. That doesn't mean they'll stay away. After your pregnancy, they sure can come back. If you're going through menopause or you're postmenopausal, endometriosis can go away, period. But if you're on hormone therapy like estrogen therapy to help with some of the postmenopausal flashes and other symptoms that are occurring, that can bring it back as well. So you want to watch out for that. As far as treatment, they can put you on hormone treatment like oral birth controls. That will help to regulate the hormones to help decrease some of the symptoms. They can also put you on some progestins, which stop your periods altogether. That in some ladies has helped as well. GnRH antagonists, that limits the ovarian hormones and can help with some. A couple of examples there are Sertraline or Antigen. Antigen drug is the name of the drug. That can help you. There are some serious side effects, especially if you're looking to get pregnant, that may be out of consideration for you. As well as GnRH agonists like leuprolide. That one, again, can definitely help with some of your symptoms, but if you're looking at getting pregnant, you may want to definitely talk to your doctor. That may be ruled out. There is a drug called danazol, which is a luteinizing hormone and a follicular stimulating hormone suppressant. So that is an option for you as well. It's kind of expensive. You want to talk to your provider about that too. As far as the pain that you normally go through with that, you can use over-the-counter Tylenol or over-the-counter Aleve or naproxen or ibuprofen and be just fine. Remember, with the non-steroidals, they do increase your risk of bleeding. If you're a heavy bleeder, that'll even make it more pronounced, so be aware of that. Other than that, you can look at laparoscopic surgery, where they'll actually go in and remove the tissue or the scar tissue. However, with that, you may have to repeat the procedure. So if you have it in a couple of years, you're feeling the same symptoms come on again, don't ignore it. Go back in and check it out. They may have to go in again. The other more major surgery you can look at is a hysterectomy. For most people with that, your symptoms will go away and stay away. But if you happen to have tissues that are outside of other areas, like along the bladder or in the abdomen or along your fallopian tube, along your ovaries, and those aren't removed, you may still have issues there as well. Like I said, with complications, you are having a higher risk of cancer down the line, and infertility could be another issue. Just some little pearls and tips that you can look at. If you breastfeed, it actually decreases your risk of having endometriosis in the future, as well as eating a lot of fruits, especially citrus fruits. That decreases your risk as well. So just a couple of tidbits to keep in mind.